we'll give it about 1 more minute and we'll start.
Sounds good.
Just to let the attendees know, there is a chat feature and a Q&A. So when Christine does her presentation, you can add that in there. Any questions you have. Okay, I think we can start, Christine.
Sounds great.
So this is Christine Uri. We'll be discussing the 988 crisis line and Rhode Island rollout. And it's all yours, Christine.
That sounds great. Thanks, Jeremiah. So I am Christine Yor. I'm a contractor with BHDDH. I've been working with them in some capacity since 2018. I was actually involved with the launch of BH Link. And since last year in February, I've been working almost exclusively on 988 planning and implementation. So I'm going to talk to you today about where we've come in that year and what we are going to continue to do after the 988 go live date nationally, which is July 16th of this year. Jeremiah is going to go ahead and share some slides, and then we can go ahead and get started. Thanks. So Jeremiah, if we could go to the next one, please. Oh, so I wanted to start by just making sure everyone had an understanding of SAMHSA's vision for 988, what that's going to look like and what's it's based on. So SAMHSA's best practice guidelines for building out a behavioral health system of crisis care nationally and also within each individual state is based on 3 components. So that there's someone to talk to, which is your crisis call center. So in this case, someone could call, text, or chat 988. It's someone to respond. So there is a mobile crisis team response to go out to those 988 contactors that need that type of service, and that there's also somewhere to go so that there are crisis receiving and stabilization services available within your state. SAMHSA has given each state flexibility in how they set up these 3 different components of an expanded crisis care continuum, so that some states might have more than 1 call center, centralized dispatch for mobile crisis response, and more than 1 crisis receiving and stabilization facility. So here in Rhode Island, BH Link is our vendor for what is currently the National Suicide Prevention Lifeline, which is what will transition to 988 on July 16th. So they will be running that call center. So next slide, please. Thank you. So SAMHSA's vision for 988 is that it is basically the behavioral health equivalent of 911. So that if you have a behavioral health crisis or emergency, whether it is a situation involving suicide, a mental health crisis, or a substance use crisis, the idea is that anyone, any age can call 988 and get the help that they need, so that you will have immediate access to effective suicide prevention, behavioral health crisis services, and connection to other resources that that person might need. And next slide, please. So Vibrant Emotional Health, who is the national administrator for the National Suicide Prevention Lifeline, is also going to be the national administrator for 988. And in helping states plan their 988 implementation, they did ask that we follow the core tenets that you see here on the screen, so that when 988 is being planned in Rhode Island, some of the things that we took into consideration were universal and convenient access. So that means multi-channel availability. So again, it will be available through call, text, and chat, that we can provide a reliable and timely response, that the public is aware of and understands when to call 988 versus 911 or the other hotlines within the state. And that once they do contact 988, they're going to get tailored and consistent support from trained crisis counselors and clinicians that is in line with SAMHSA best practices, and that their calls are answered on a local basis, and that we connect them to local resources when needed, and that we follow up with those people who call and consent to receiving follow-up services. So all of these things were taken into consideration when we started Rhode Island's 988 planning. And the next slide, please. Thank you. So this started back in February of last year. Rhode Island was one of the states that received a planning grant through Vibrant Emotional Health, where we were able to bring together a statewide planning coalition to help us draft the 988 implementation plan that we submitted to Vibrant Emotional Health and SAMHSA. So this planning coalition was created from a statewide stakeholder population. So we've included various state agencies, community providers, those with lived experience, those representing special populations who are more highly impacted by suicide. And we've continuously added to this stakeholder coalition so that we made sure that we were getting the representation that we needed to build the best 988 system that would work in the state of Rhode Island. So we used the expertise and the perspectives of the stakeholder coalition when drafting the implementation plan that we submitted to Vibrant Emotional Health. The draft was submitted in September of last year, and the final version was submitted in January of this year. Next slide, please. So some of the expectations from SAMHSA and Vibrant Emotional Health are that within the first year, so that would again start in July of this year and go through the end of June next year, is that each state has 24/7 in-state coverage for calls with at least a 90% local response rate. And the good news is we're building on a great foundation here in Rhode Island. So BH Link has consistently delivered a local in-state answer rate in the very high 90th percentile. I believe last month's response rate was 99%. So at any point in time, we either have the highest or one of the highest local response rates in the nation. Another first-year expectation is 50% coverage for texts and chats that are local. So this is a new procedure for Lifeline centers that will be handling 988 contacts. Currently, you are not expected to handle text and chats. Those are handled by a national backup center. But starting in July, we're expected to cover 50% of those. So again, the good news is BH Link started a pilot text and chat program a few months back, so that they are actually one of the Lifeline centers nationally who is covering texts and chats to the National Suicide Prevention Lifeline right now. They've done that covering one shift a week, and the expectation is they're going to build in additional staffing and coverage so that we can meet that year one expectation. Another new expectation is on follow-up procedures. So for those 988 contacts who confirm that they are at risk of suicide and that they express consent to receiving follow-up services, Vibrant's expectation is that you provide at least 50% of those. And again, BH Link is currently working on what those follow-up procedures will look like and how to implement them. In year 2, the numbers go up, as you can see from the slide there. So it's 80% coverage for texts and chats, and 100% of those who want follow-up receive follow-up services. And also that we are now thinking about the expanded system of care that goes with 988, which are those mobile crisis teams, the someone to respond, and the somewhere to go, which is having resources and capacity to link people to receiving and stabilization services if they need them. So SAMHSA's expectation for year 1 is that states focus on the 988 contact center and building up capacity for calls, texts, chats, and follow-up. And so that has remained our priority here in the state, though we are already in discussions about how do we build out these other services that are expected to be a part of the 988 system of care. SAMHSA and Vibrant Emotional Health have also asked that states do not engage in extensive public awareness campaigns during year 1 so that we can make sure we're building up capacity so that we can meet the projected volume increases that we were given. So while SAMHSA and Vibrant Emotional Health may be doing some public outreach around 988, and obviously the media has already started covering it, the expectation that Rhode Island would publicly market it is not something that we would consider until year 2. So next slide, please. So another question that we get asked often is, how is 988 being funded? I have some basic information to share with you here. It's not my main responsibility to deal with the legislature or the budget, but I can cover these points here. So there is 1.875 million in the proposed FY23 state budget to help cover costs for year 1. Other funding as needed will be covered by other federal grant sources. And we are currently assessing the feasibility of establishing a 988 fee. So the federal government did pass that states are allowed to assess a 988 telecoms fee, similar to the one that is assessed or can be assessed for 911. And by federal law, the fee can cover anything that is associated with running the 988 call center. And it can also cover the expanded continuum of care. So essentially anything that's connected to 988 could be covered by that fee. And another thing that's special about that fee is it cannot be used for any other purpose. So it would have to be assessed and used for only things that are related to 988. Currently, we don't know if that is going to pass or not. And we also don't know what the level of the fee would be if it does pass, but we plan on keeping everyone updated as to whether or not that would happen. And next slide, please. Thank you. So the state was also awarded through the National Association of State Mental Health Program Directors 2 Transformation Transfer Initiative or TTI awards that are focusing on developing shared 988 protocols, as well as training for the 988 call center staff and other relevant partners. So we have been awarded that money to work with creating training and protocols for adults and special populations, as well as specific to children and adolescents, because again, 988 does cover the lifespan of anyone who wants to call. So there isn't a separate 988 for children and adults. 988 will serve all ages. So what we are doing is meeting with different stakeholder members to start to develop what the ideal 988 training plan should look like. So not only training on how to deal with someone in crisis, but also trainings, for example, on how to deal with an elderly population and what is the preferred language to most appropriately help someone in crisis who is a member of our elderly population. I was just in a meeting where we are talking about what is the best way to engage LGBTQ plus youth and what are the different types of training that you would need in terms of what is an effective thing to say to someone who might chat versus ineffective. We're also developing those protocols so that, for instance, if someone were to call 211, but would be better served by 988, what does that warm handoff process look like, and vice versa? So this work has been ongoing since April of this year, with the expectation that we are going to continue to do the work until we've created that training plan and curriculum, as well as the training assets that we can then share with our partner agencies, and to the point where we have manualized those call, text, and chat protocols for 988 and other partners across the state. So you can see on the slide some of the organizations that we've already met with. We are continuing to also meet with E911, as well as having a meeting with the City of Providence 911 team coming up in a couple of weeks. And next slide, please. Thank you. And then we were also recently granted a no-cost extension on that 988 planning grant that we had with Vibrant, because we did have some funding remaining. So one of the awardees on the grant is Sumluck. They were brought on to do some training and provide subject matter expertise in the development of the plan. And they are working to develop a needs assessment and recommendations for recruitment and retention of staff for the 988 call center. I'm sure it's no surprise to anyone in the audience that there is a workforce shortage, and that workforce capacity issue is one of the hardest things that we're dealing with as we plan for 988 in the state. And so we wanted to be able to figure out new ways, better ways to recruit, as well as ways to retain staff once they've been hired. So what are the best practices and successful program structures that would allow people to flourish in that career choice and stay there? And it's also going to include investigation of alternate employment pools. So are there groups of individuals that we're not currently looking at as people who would be really good at answering calls, texts, and chats at 988? So for instance, is this something that we look at in our higher ed institutions where people are majoring in social work, counseling, psychology, et cetera, those types of things? So that has an anticipated start of June 1st, and we hope to have that finalized report by the end of August. And the next slide, please. So wanted to share my email address, as well as Corinna Roy, who is heading up this planning initiative at BHTDH for 988. So if you have any questions, please feel free to reach out to us, and we'll be happy to get back to you and share whatever information that you need. And at this point, wanted to just turn it over to the group to see what kinds of questions they have. I see that there was one question in the Q&A, who was on the stakeholder committee. So that was an extensive list of individuals across the state. I think at last count, there might have been 40 people on the committee. And as I said, as people give us suggestions, we invite other people to participate. We've drawn from that stakeholder coalition to get people to help us develop the trainings and protocols. And again, people have also referred other organizations or specialists, and so we've pulled them into that work as well.
There was something also in the chat
Okay.
by Susan Collins.
Will there be training specific to managing psychosis? So at this point, we're working with the subject matter experts on developing the trainings. So I'm not a clinician, so I can't speak to what those trainings should include, but they are also in a framework of what Vibrant Emotional Health recommends. So I would imagine that if the clinicians involved in helping us develop the training feel that that is important, then that is something that will be there. Again, the training planning that we're doing is focused on building, like I said, that ideal curriculum, and then also figuring out where does training currently exist that we can leverage. So for example, Vibrant Emotional Health is going to provide each 988 center with 3 core trainings. And then we're also looking at what training do we need to develop in the state so that it's specific to Rhode Island, so that we can leverage local expertise and connection to local resources. And the training is also going to focus on making sure that the 988 call center staff has knowledge of the local resources that they can link and refer people to. So the call center jobs, certain call center jobs require a degree. So if you are a in the supervisor clinician role, you would need the relevant degrees. For the call center staff, I believe an associate's degree is preferred, but not required. If you go to the CCA website, who actually does the hiring for BH Link, they do have the 988 positions advertised, and there is a description as well of what is required for each of those roles. And yes, I did see that Beth said NAMI Rhode Island was one of our stakeholder participants. So thank you, Beth. We appreciate that. Do we have any other questions or comments? I did just want to reiterate that this is an ongoing, and as you can imagine, a very complicated process. And we are working very hard to ensure that we have representation from all stakeholder populations, so that as we build out 988, we're building it out from the perspective of the caller and ensuring that the system we have in place will serve them seamlessly, no matter what types of support or resources or connections that they need. So we're working really hard, for example, on warm handoffs, so that someone in crisis doesn't just get referred to someone else, doesn't have to repeat their story to another counselor, but that we can work together to ensure seamless transitions and supports and disposition for resources if necessary. So I see another question, where do peer specialists fit in? So that is one of the groups that we want to make sure is represented on 988 call center staff. And we have spoken to some representatives in terms of peers. They're a group that we are going to be interviewing for that retention and recruitment study, so that we can make sure we have access to that group in case they do want to pursue one of the opportunities, but also so that we make sure we are appropriately representing the peer perspective. Do we have any other questions? So again, please feel free to reach out if you have any questions. And if I can't answer them myself, I will either connect you to someone who can or get the answer to your question. I see that Liz is asking, will volunteers be part of the call center? Liz, that's a really good question. There are other Lifeline centers across the country that do rely on volunteers as part of their contact center staff. That is something that we are investigating. We are also investigating, as I said previously, a higher ed connection and whether or not this could be part of an internship program on an ongoing basis. I think whatever different types of employment pipelines we investigate, one thing that we want to make sure people understand is that there is training that goes into this so that people can effectively not only handle the calls, but can also practice self-care and make sure that they're taking care of themselves as well. So we would want to ensure and try to retain these people for longer periods of time. Okay, well, do we have any other questions? Okay. Thanks, everyone. And if anyone in the audience does want to be involved, has expertise that they want to share in terms of building this out, then please feel free to email me and we can figure out where you best fit in and how you might help us develop, whether it's trainings or representation of a special population or whatever it is. I would be happy to discuss that with you.
Thank you, Christine.
Sure. Well, thank you, everybody.